is always a work in progress as far as I'm concerned. It's a never-ending journey.
Referral. Okay? If I go to hers, I can locate it there.
The good and the bad and the ugly of our EMR implementation. I think that in terms of the good, I don't think you can underestimate the power of being able to implement across 11 clinics within a year.
Working in this is that we had to have a paradigm shift in the way we thought about electronic records and electronic documentation.
And I think we really had broad-based buy-in. I think that staff, providers, administration, executives, all understood why it was important.
When we initially started the EMR, it was a little difficult. I mean, just the knowing that we're going to do something new, some kind of a change.
The physician or provider response has run the gamut from very enthusiastic acceptance to very enthusiastic rejection.
I could say as a provider, the kind of having a computer as a third person almost in the room, so usually you're sitting there with the patient, and this was a real, transition. You're losing eye contact, you're, kind of shifting back and forth between the two, and so it took a while to really transition and to do that comfortably without feeling like all of your focus was on the computer.
I think a lot of it was also just anxiety about change, anxiety about not meeting performance goals.
We had to rethink all of our processes. We had to think about how our patients come in to see us, how we manage their patient flow during a clinic visit, how we manage education, referrals.
Adoption of the technology within the provider community, that's been an outstanding success. And we have, now we're, I would say, providing a better level of care and a more consistent level of care.
We brought our whole system live in a couple years, which doesn't sound, it may sound like a long time, but in fact, in terms of getting a multi-clinic, multi-specialty practice live was actually a pretty good timeline.
To constantly learn and change what you're doing at the time. When you first started with a new system, it's difficult to know exactly how it's going to work out. So I think to make sure that the whole clinic is ready for the change and ready to adapt to new ways of workflow.
That an EMR is not just a computer program, it's not just a new tool, it's not an IT project, it's really a fundamental transformative change in workflow and in the way people communicate, in the way that people document.
I also think this is a really incredible, unique opportunity to rethink the way you function in clinics.
As a physician, I have been using the electronic medical record myself, and that has given me a unique perspective not only on the opportunity of the system, but also the challenges in adopting it. It really requires providers, not just providers, but all the staff involved, to practice with our patients in an entirely different way.
As physicians, we're trained that we have two measures, maybe three, of how well we do our job. One, do our patients like us? Two, are our patients alive? And three, the note we create every time we see a patient. And really, the truth is, most patients like us and most patients live. And so we measure ourselves on how well do we communicate with our colleagues? What does that note really look like?
At this point, we're getting requests for additional functionality. People are wanting to make some changes, and we're just in the process of looking at kind of a major change in how we do things to make the system work better all across the organization.
It has put us in a great position to now implement our inpatient electronic medical record.
Are from San Mateo. They help us with the financial portion.
No. Me llaman a mí.
¿Le llaman? Doctora.
Ajá, sí.
Bueno, más bien al doctor. Aquí tiene su...
Está bien.
Ok, perfecto. Estas son las etiquetas que le va a entregar a la enfermera. Cuando suba al segundo piso, ¿ya sabe dónde es?
Sí, yes.
Ahorita la encuentro ya para darle la copia.
Okay,
Gracias.
It's really helped our workflow because it's more predictable pace in receiving prescriptions rather than a lot of the customers showing up at the window with prescriptions that we have to process that way. And we've actually been able to increase our volume of output of outpatient prescriptions by 25% without adding new staff. And that's primarily because of electronic prescribing. To talk at some point about these electronic
we actually were able to do a very aggressive timeline because of the dedication of the staff and seeing the strong sponsors and their dedication to the project. So I think that that is the key to the success.
Of course, there were some struggles at the beginning. It was difficult integrating our hospital information system with ECW. It was something new. So we did have a few late weekends prior to our go-live trying to coordinate and clean up all of that information.
So one of the keys is going back through now and doing the things that we didn't quite understand that an electronic medical record could do, and now integrate that into the process.
I think the preparation was really important, and I think the key element in the preparation was to figure out at what technological skill level were all of the staff.
I think the biggest challenges initially were trying to figure out how this would work in our current workflow.
The other really big issue that we recognized is that an EMR implementation is change management. It's change management from day one to day whatever.
Biggest liabilities. I think vendor selection is also, doing a lot more due diligence on vendor selection and who we picked and why we would pick them.
I would say to hang in there because right up front I think is the most challenging time. The first few months were very challenging, a lot of stress, a lot of learning, a lot of questioning and rethinking everything we do.
Keeping an open mind and not trying to reproduce your current process on paper and just turn it into electronic.
It is a big step above what we were using previously, I believe. Now we just have to merge them together.
Instead of fighting the system to try to make it fit how the clinic used to work, try to use the clinic now and adapt it to the system.
It's definitely a culture change.
We made some assumptions going in that what people told us would work would actually work, and given it to do all over again, I think we would have taken everything with a grain of salt.
Discuss, discuss, discuss. Think even of the unthinkable. What perhaps you think that is insignificant now may be the biggest impact later on.
In the future, I would love to see patients having access to inputting some of their health surveys directly into the medical record.
This has been such an incredible opportunity for our organization because not only has it enabled us to be a forerunner in terms of public hospitals implementing electronic medical records, but it's also given us the opportunity to really examine and explore our workflow so that we are as efficient as possible.